Hello, I'm Dr. Sai Krishna B Naidu. I'm the orthopedic surgeon at Fortis, Richmond Road. I head the department here for the bone and joint surgery. At Fortis, we specialize in certain aspects of joint replacements. I'm here to talk about the joint replacements today. I, as a knee surgeon, have specialized in particularly evolving over a period of time what we believe in called as restoration, reconstruction and revision of the knee. So what it means is basically we preserve the knee, if required we change the knee, or we also do the revision of the knee which has been failed or done by somebody else. And that is what its simple terms mean as a knee surgeon. So what is joint replacement? I'm here to talk about a knee joint replacement today. I would like to briefly explain you what exactly it means. There's a lot of myth about this joint replacement today. They're very much worried about what is the success rate, will it fail, will we be able to walk post-surgery? I'm here to address those simple questions today in a brief talk. When do we do joint replacements? We do basically when the joints are completely worn off. If I give you an analogy of saying a car tire, when do we change a car tire? We change a car tire when it is completely worn off. In the very same similar circumstances, the knee joints also wear off. An average life expectancy of a joint when you're born is about 50 to 60 years. So it is inevitable for everyone to have a wear and tear, and it is a normal process. This is not a disease. What I want you to understand, it is a normal process. The success rate of joint replacement is very high. So this is a normal knee, what I'm going to briefly explain. This is the articular cartilage. Okay, this is how we are born with. As we tend to grow older, it starts wearing off, and that is what it happens. So when the wear happens, the bone underneath and the bone underneath starts rubbing onto each other, and that's where you start getting pain. All we do is we change that articular surface with an artificial metal on both the sides, supported by a plastic implant in between. So this restores the knee completely in a normal straight leg alignment. They were able to do all activities what they were doing prior to age of 40 and 50 with complete normal activities. So who are the normal population who get joint replacements? So joint replacements are done for various conditions. Most common in India is about osteoarthritis, followed by rheumatoid arthritis and various other conditions like psoriatic arthritis, traumatic arthritis. In case of there is an injury where patient is elderly, rather than fixing it, we replace the joints. And to a certain extent, we do it for tumors as well. The most common question the patients ask me is, how quickly can I walk? So we advise them to walk the very same day if the pain permits. Otherwise, 99% of the people walk the very next day with complete weight bearing. They do their activities by end of third days independently without any support with the walker, like such as going to toilet, a normal chores such as going to toilet, coming back to the bed, sitting down on the dining table, and so on. This is one of the most safest surgeries, as we are tending to reach about 4 lakh joint replacements in our country. So there is also a lot of campaigns being promoted in joint replacements saying treatment zaruri hai, which means we advise them not to lose their quality of life just because they have pain. Pain changes a lot of factors in human being, such as disturbed sleep, lack of quality of life, lack of social involvement because of the pain. These 3 things cause a significant impact on an individual. When we have a treatment, why not opt for it? So once again, I reassure my patients that is one of the most successful surgeries. There are other options to joint replacements. In today's date, we also do a half knee replacement where the pain is almost nil, where they walk the very same day. So there are very selective patients where we do for them. So as initially told, we restore the knee. If not required the joint replacement, we also restore the knee depending upon the categories of patients whom we see. So I would suggest my patients not to worry. Approach your doctor, ask them for the right advice, and most importantly, ask them rightly whether you will operate on my knee. Thank you.